multiple sclerosis is a progressive degenerative disease of the brain and spinal cord. Doctors say MS is an autoimmune disease where the body attacks the covering of nerve fibers.
But now a researcher in Italy has found what may be the trigger that sets MS in motion, which has set off an outcry among MS doctors, researchers, and patients. Dr. Max here now with this potential breakthrough. Good morning.
Good morning. Well, that remains to be seen. We'll talk about that. Good morning, Kate. Good morning, Maurice. What we do know so far is that Dr. Paolo Zamboni from the University of Ferrara in Italy has sparked a controversy as many MS patients on blogs and chat rooms demand access to what seems like a miraculous treatment, while many experts urge caution and more research. Here's what it's all about. John Sheehan was diagnosed with multiple sclerosis almost 4 years ago. Since then, the former social worker has developed trouble walking, a lot of pain, and things you can't see.
Memory issues and chronically have to go to the bathroom and those type of issues, struggles.
No one knows what causes MS, but this Italian researcher has uncovered a link that could become a breakthrough in both understanding the cause of MS and its treatment. Seems that as many as 9 out of 10 MS patients Dr. Zamboni screened had unusual narrowings in the major veins that drain blood from the brain and spinal cord, a condition called CCSVI.
And this is very important because simply means that the toxins and the viruses and whatever cannot be properly drained. And this is a very important adjunctive factor, for example, in a disease like multiple sclerosis, in which the inflammatory process is prominent.
The theory is that the backup of blood and possibly cerebrospinal fluid is what triggers the autoimmune reaction that becomes MS. What makes this even more intriguing is that when some of these patients had a balloon angioplasty and a stent to open the narrow veins, their MS got better.
Patients with severe disabling symptom have some improvement, stabilization, and constantly what I referred you before, the reduction of the fatigue. This is very important.
But many researchers are skeptical. They point out that some people without MS also have the vein narrowing, and that MS symptoms often come and go and may have nothing to do with the balloon angioplasty. Still, the MS Society says the link is strong enough to warrant a major research effort.
And so now we're actively pursuing it by inviting investigators throughout the world to submit their proposals to us on this. And we recognize that this is really going to be a concerted effort.
But as we said, many MS patients on blogs and chat rooms are clamoring for faster action, especially around the balloon angioplasty, which they think could be a new and effective treatment. Meanwhile, MS centers from around the world have submitted research proposals which will be funded by the MS Society by early summer. The first step is to see if the link between narrowed veins and MS holds up in bigger studies, because we don't know exactly what the real numbers are until we look at more normal people and more people with MS.
But you can understand the urgency. If you've got this
Absolutely.
and you see angioplasty might help, why not just go for it?
Well, you know, I mean, that's what a lot of people are saying. Why not go for it? But, you know, the angioplasty on these veins can be a pretty risky proposition. And in fact, a couple of folks who've had it done have had some problems. Now, and if patients start having the procedure outside of a clinical research trial, we may never find out exactly what the connection is between the narrowed veins and MS. It's frustrating, but MS history has unfortunately been marred by failed treatments and even out-and-out snake oil quacks who've tried to sell, you know, miracle cures before to desperate patients. So the MS Society and researchers want to make sure that we do it the right way so we really get the real answer here. Yeah. But it's an exciting area, and they're very interested in it because it may be a whole new area for research.
Right. Yeah, still a glimmer of hope,
yeah,
right?
It could be.
Dr. Max Gomez, thank you.